Cancer is a disease that results from the uncontrolled growth and spread of abnormal cells in the body. Normally, the body regulates cell growth and division, but in cancer, this process goes awry, and cells begin to multiply and accumulate in a way that can lead to the formation of tumors. Cancer can occur in any part of the body and can affect any organ or tissue. There are many different types of cancer, and each type can have different symptoms, causes, and treatment options. Some common types of cancer include breast cancer, lung cancer, colon cancer, and prostate cancer. While the exact causes of cancer are not fully understood, certain risk factors, such as genetics, lifestyle factors like smoking or excessive alcohol consumption, and exposure to certain chemicals or radiation, can increase a person's likelihood of developing the disease. Treatment for cancer typically involves a combination of surgery, radiation therapy, and chemotherapy, as well as other targeted therapies depending on the specific type and stage of the cancer. Cancer is a complex disease that can affect humans in different ways depending on the type of cancer and the stage at which it is diagnosed. In general, cancer occurs when cells in the body grow and divide uncontrollably, forming abnormal masses of tissue called tumors. These tumors can interfere with normal bodily functions and, if left untreated, can spread to other parts of the body. The specific effects of cancer depend on the location of the tumors and the organs or tissues they affect. For example, lung cancer can cause shortness of breath and chest pain, while brain cancer can cause headaches, seizures, and changes in mental function. Some common symptoms of cancer include fatigue, unexplained weight loss, pain, and changes in the skin or moles. In addition to physical symptoms, cancer can also have emotional and psychological effects on individuals and their families. Many people with cancer experience anxiety, depression, and other mental health issues, and may require support and counseling to manage these feelings. Cancer can be treated in many cases, although the treatment and its success depend on various factors such as the type and stage of cancer, the patient's overall health, and the individual response to treatment. The main types of cancer treatment include surgery, radiation therapy, chemotherapy, targeted therapy, immunotherapy, hormone therapy, and stem cell transplantation. Often, a combination of treatments is used to increase the chances of success. In some cases, cancer may be cured completely, while in others, the goal of treatment is to control the disease, slow its progression, or improve quality of life. Unfortunately, there are also cases where the cancer cannot be treated effectively, and in those cases, the focus shifts to palliative care to manage symptoms and provide comfort to the patient. It is important to note that early detection is key in improving the chances of successful treatment, which is why regular cancer screening is recommended for people at higher risk or with a family history of cancer. Precautions of cancer. Avoid tobacco. Using tobacco in any form, including smoking, chewing, or inhaling secondhand smoke, is a major risk factor for cancer. Eat a healthy diet. A diet rich in fruits, vegetables, and whole grains can help reduce the risk of developing cancer. Maintain a healthy weight. Being overweight or obese increases the risk of several types of cancer. Exercise regularly. Regular physical activity can help reduce the risk of cancer, as well as improve overall health. Protect your skin. Exposure to ultraviolet, UV, radiation from the sun and tanning beds can increase the risk of skin cancer, so it is important to use sunscreen and wear protective clothing when spending time outdoors. Limit alcohol consumption. Heavy alcohol consumption is a risk factor for several types of cancer, including breast, liver, and colorectal cancer. Get regular cancer screenings. Early detection of cancer can greatly improve treatment outcomes, so it is important to follow recommended screening guidelines for your age and gender. It's important to note that while these precautions can help reduce the risk of developing cancer, they do not guarantee prevention. It's also important to talk to a doctor about any concerns or risk factors for cancer.